think now more than ever, the importance of talking the same language in healthcare is so vital. And you can see this mentioned in the WHO Global Patient Safety Challenge, Medication Without Harm. But it talks about some of the early priorities, i.e. high-risk situations, polypharmacy, and transitions of care. Things we come across day to day in the work that we do. And it is that communication. It is about speaking the same language. And this is what the dm+d brings. So you can imagine talking about the electronic prescription service. Part of the pandemic, we have an enormous amount of virtual clinics, yet still paper prescriptions and a home-based delivery service. TCAM, or transfer of care around medicines, rethinking the discharge process, about wrapping this around the patient and their needs, sharing with others to ensure that we hand on the baton around medicines and receive it back if they come back to us. This is vital, and this won't happen without the underpinning coding, without us speaking the same language. And this is what the dm+d brings. Think about OpenRx, so that we can now, without having to have very expensive software, look and analyze information, prescribing patterns. Or think about RX Info. Right through the pandemic, we were able to supply to the shelf location the stocks we were holding because we were using the dm+d. Think about the payment for community pharmacies. Again, with the implementation of the dm+d as part of the EPS and before that. Think about what we might do with SAC data. That's really key. We have one of the most comprehensive databases in the world. We enable dm+d within that. That could be really interesting. And where does this lead us? AI. This is going to be vital as we move into the 21st century and move beyond that in terms of how we look at drug use, how we analyse its effectiveness, medicine's value, if you like, the outcomes. So using this sustainable, simple, if you like, coding system so that we are all speaking the same language. Then we set up the platform of the sort of AI that is going to enable us to make that step change in how we manage patients' health with increasingly advanced medication. I am very supportive of the dm+d.